My agency is the biggest agency in government. It's twice the size of the Pentagon. It represents about 20% of the U.S. economy.
Hey, I had a town hall. I had a fire captain show up to this town hall. Somebody who worked at Ground Zero, and he is somebody who said he was diagnosed with cancer. He said he's on borrowed time, and he was livid, absolutely livid about what he said, the administration gutting the World Trade Center health program. And we've talked through some of these cuts that have happened before, some staff cuts, some maybe brought back on, the administrator cut. I just need to hear from you. I promised this fire captain I'd ask you about this. What in the world happened? Why was the staff cut for this program? What are we to expect going forward?
I restored the staff to the program.
But why was it cut to start with?
It was, it was part of the overall budget cuts. Our agency was asked to make very, very serious budget cuts that were going to be painful, and some of them should not have been made, and that was one that should not have, and I reversed it.
Were you unaware, or were you aware that the decision to cut NIOSH staff would cut that World Trade Center health program?
Well, my agency is the biggest agency in government. It's twice the size of the Pentagon. It represents about 20% of the U.S. economy. We have hundreds of institutes and sub-agencies. We try to be as careful as we can about what we cut and what we didn't. We made a couple of mistakes.
No, I don't think you were trying to be as careful as you can. I mean, that's the problem that we've seen by rushing these decisions. This was, I know, early in your time there.
Senator, I understand. I understand that if you look at this from a distance, you'd say, why don't you just do this surgically and cut one person at a time? This agency has grown so big, so fast, and everybody who comes in says, I'm going to cut it down, and nobody's been able to do it. And there was an understanding that the longer that you wait, the more the inertia kicks in. And we had to act quickly so that we can do something for the American people that is lasting. And we understood that there would be some mistakes made and that we would go back and reverse them when they were made. But it was more important to do decisive action quickly that could eliminate the metastasizing of this agency to, which was growing and growing as our health declined.
So where is this going to land now? Can you tell us right now that the staffing of the World Trade Center health program will go back to where it was before you became secretary?
That program will continue. There will be continuity in that program.